everybody. Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. And this week we have a really awesome special guest. We really haven't had someone like this come on our show yet, so we're really excited to dive into some of these subjects. I want to introduce you to Dr. Karen Giles, founder of Breakthru Psychiatric Solutions in Georgia. Dr. Giles, so nice to meet you.
Hi, Rachel. Thanks for having me. I'm thrilled to be here and happy Friday.
Happy Friday. I am super excited to chat with you, and I'd love to kind of start this off with something that I think everyone enjoys. I think everyone loves hearing about who you are, the origin story, what had inspired you to open up your own practice. So I'd love to hear first about that.
Yeah, my origin story is a little long. I'm going to try to keep it as short as possible, though, to not bore anybody. But um, I went into medicine later in life. Prior to going into medicine, I worked in the medical device industry. I worked for Medtronic, helped them develop products for delivering drugs into the brains for patients with Alzheimer's disease, Parkinson's. So I really thought back then that maybe I'd become a neurologist. I was working with some of the top neurosurgeons in the world, top neuroscientists. It was really exciting. And so they really inspired me to actually get out of like the project management world and get into medicine. And so that's how I got into medicine in general. And definitely in med school thought I would be a neurologist, but then started to see psychiatry and really saw a lot of exciting cases in psychiatry firsthand and saw patients getting better in the field of psychiatry. And that just really became my first love. I loved hearing patient stories. We get a lot of time with patients in psychiatry. And I entered psychiatry in a time where we were starting to use interventional treatments. And so it was really kind of going through the whole field of psychiatry was really going through a renaissance while I was finishing up my residency and thinking about what I wanted to do post residency. And really saw a lot of patients not getting better with medications and therapy, which is kind of the bread and butter for psychiatry, which is a bit hard to see when you're relatively like new in the field and you're excited to like put your skills to work for patients. But fortunately, I trained at Emory and got to see a lot of these newer treatments for patients with treatment resistant mental health conditions and got great training in it and decided to bring these treatments to the community outside of the academic setting.
I love it. I love your whole background and you had all this training, but I just love your passion and zest for seeing people getting better, trying new things. And I think, as the world and healthcare is evolving, why not, explore and why not see what's out there and try new things. So I think that's really great. But in terms of some of what you do, what would you say is like the most common areas that you find, you know, people are struggling with right now? What common areas do you feel like you are currently treating?
So the most common conditions that we see in our clinic are depression and anxiety and a lot of trauma symptoms. Those are probably the top three. And they tend to kind of run together. Like more often than not, people are going to have hard to treat depression and anxiety. And a lot of them unfortunately have a trauma history. And a lot of times those trauma symptoms are like percolating and impacting their depression and anxiety. We see a population of patients that we call treatment resistant. So treatment resistant depression, treatment resistant anxiety, treatment resistant PTSD. Those aren't technical diagnostic terminologies. They're more terms that we use to describe people where they've tried 2 or 3 medications that are indicated for their symptoms, but that they're not getting better with those medications. And a lot of our patients that we consider treatment resistant have also tried psychotherapy, and they haven't found it to necessarily get them fully into remission, meaning like they're still struggling with moderate to severe symptoms. And that's really just not acceptable, especially when we have a lot of other options available. So patients come and see us after they've tried medications and therapy, and they're still not at their back to their baseline. They're still struggling with their quality of life. They're still struggling to function, and so that's when we see them.
Yeah, that must be so hard. People that have, went through, a whole list of things to try, things to do. But I'm so happy that you're there to help them, especially when things are a little bit more resistant and they have a place to go where it's like, this is it, you know? So that's really terrific. How would you say though, what I want to know a little bit more about the modalities that you're using, because I think that will be really interesting to chat about, but also how your approach is different. You talked a little bit about, how you're working with people, but I'd love to know what makes you guys different. And that might be in the modalities that you're using, but would love to hear more.
Yeah, so we are part of a field of psychiatry that's pretty new and emerging. It's called interventional psychiatry, and really what that means is we do treatments that are in the clinic. So we're still an outpatient facility, but patients have to come into our clinic each time they get a treatment. They're not going home with our treatments. So that's one thing that kind of distinguishes us, and that's because we're often using technology or treatments where patients need to be monitored in the clinic, or the technology it's like medical devices that are so big and expensive that you wouldn't be able to like have it in your home yet, but maybe in the future we'll have some of these like more available in the home. So the main treatments that we're doing are transcranial magnetic stimulation for depression and anxiety. That uses a big medical device that patients come into the clinic for and get their treatments. We also do ketamine-based treatments, so Spravato, which is FDA approved for treatment-resistant depression and depression with suicidal ideation. And we also do IV ketamine treatments, which are used off-label for all sorts of mental health conditions, including depression, anxiety, PTSD, OCD. So those are all done in the clinic. We have a new treatment called PRISM, which is FDA cleared for PTSD. This is the first time we've ever had a new treatment for PTSD in 15 years, which is kind of sad. But now we actually have something new that works. And so these are all treatments that are, these treatments are being done all over the United States, around the world. But our clinic's unique in that we try to bring all the latest interventional treatments into one place so that we can be nimble. Sometimes these treatments don't work, and so we want to be able to pivot, try something else if a treatment's not effective. Or sometimes a treatment might help with someone's depression symptoms, but we're still left with the trauma and anxiety symptoms. So we've got treatments for that. So we pivot if we need to. We also, with Breakthru, the thing that we really pride ourselves on is being high touch. The patients and their families are our North Star, and we really like live and breathe that. Everybody on our team is there to support our patients. So
Yeah.
we don't have a high volume of patients. We take just enough patients that we can deliver like high quality care, spend a lot of time with our patients. We really want to get to know them. We want to see them get better, and we want to make sure that they feel like they're getting the time and attention they need to heal. And that takes a lot of time and attention. I mean, understandably. So we don't see tons of patients a day on purpose, and we're able to make it work.
I really love that you are so patient focused. That is precisely a lot of the reasons why people decide to go with private practices because, they know they get that individualized attention. You don't want to be a factory. It takes time to really assess and take care of your needs in the right way. And so, and I love all the modalities that you have. You're able to pivot, which I think is really unique, because you don't just do one thing, you actually have a couple things that you do extremely well that can help someone. So I think that's really fantastic. And why is it that it's taken 15 years to have something to help with PTSD?
That is a great question. I think there's still probably a lot we don't know about like how these conditions develop. I'm sure that there are drug companies out there trying to create new drugs, but we know like drugs just don't always work, or medications don't always work.
Yeah.
Usually in about a third to 30 to 40% of patients with depression at least don't respond to medication. So it makes sense that we need to start thinking about treating conditions differently. And interventional psychiatry really approaches mental health conditions from like a circuitry or a neuromodulation standpoint. So we're just viewing the brain and these conditions in a very different way, and then treatments are being developed to target those symptoms in a very different way than how medications target symptoms.
Yeah, absolutely. I thank you for telling us that. I mean, there's so much information. I feel like you just don't know what you don't know. So I appreciate, I think everyone here is very interested in that. But I would love to pivot because you do so much. But I'm sure you get loaded with lots of questions. There are, the age of Google and AI, everyone's typing in their questions and receiving answers that may not be so true, right? It can be a useful tool at times, but not all. You can't always believe what you read online. And so, what are some of the largest misconceptions that you feel like you are constantly debunking in your practice?
Ooh, that's a really good question. I think sometimes there's just fear of like with ketamine, especially, people want to know about like, are they at risk of getting addicted to ketamine? And I
Mhm.
always tell people like the way that we practice it, where it's an in-office treatment, we're not sending you home with a prescription for ketamine. We do
Yeah,
not do that. That really creates a barrier. And so we haven't had people get addicted to ketamine or other substances when we're doing it with strong boundaries and really kind of in a way we're kind of medicalizing it by like saying you
yeah,
have to come for treatment, and that's how people view it. So that's a misconception, and of course ketamine has been abused, and unfortunately, we all know about what happened with Matthew Perry, and it was incredibly tragic. And so we want to make sure that never happens to anybody that we're treating. So
yeah.
that's a big one. I think a lot of people just worry about the efficacy of these treatments. They've tried a lot of medications, so they're like, well, really, why would I have a lot of hope that one more thing's going to work? But the data for these treatments is really good. It's the likelihood that another oral antidepressant is going to work for someone with depression after they've tried 4 medications is 3%. That's really awful.
It's
The likely,
terrible.
right? Like, what are we doing?
Yeah,
Why are we throwing medications at people? It doesn't make sense, and that's what the data says, and it's really compelling. It's time to try something that actually works, and our treatments have an efficacy rate of more like 70%, and a remission rate of more like 30 to 40%. So an order of magnitude more likely that someone's going to get better. So I think there is some just, misconception as to how effective things are. Why should we bother to try something else? A lot of patients don't know that these treatments are covered by insurance. So at least TMS, Spravato are. Um, Prism will probably be covered in the next year. So there's a lot of like movement towards making these treatments more accessible to people and to allow people to use their commercial insurance as they should. Um,
yeah. There's such, everyone is talking about mental health right now, as they should. And I think it's great that we're trying to move this into a better direction. People are now talking about it, which is important. There's a lot of people that just weren't talking about it before. It was taboo. I'm glad that we're moving away from that narrative, and people being open to exploring other options.
yeah, absolutely.
Hmm.
Yeah, there's a lot of options now. It's exciting.
Yeah, absolutely. And, kind of speaking of options and advice and a little bit more about what you do, this is kind of a two-pronged question, which I like. But is there a few easy tips or common advice that you would give to a client or a patient, as they're seeing you, things to do, things to better their mental health, as they might be going through treatment with you? And then on the other side, would love some pro tips from you, for maybe some other providers that are either starting their practice, maybe they're long into their journey, but has there been something that has been really pivotal, important to you in your practice today that you'd love to share with others?
Ooh. I think the theme for both of those questions is team. So don't I don't want patients to feel like they're on an island and like we're not going to be the only member of their care team. It really does take a whole team to help people with these more treatment resistant conditions, and it's not any fault of the patient or client. It's just these are tough situations that affect them, they affect their families, so we need to get more support and like create a whole system of support around them. So like we're one member of the team, but
Yeah,
there's usually also a primary psychiatrist who's managing the medications. We
yeah,
also probably need a therapist who's really addressing things that are coming up. Sometimes like as people are getting better, their with their depression, for example, their anxiety might ramp up, or like maybe now they're better and they can address, they need to start addressing some of the things that got put on hold. That can be really stressful. So having a therapist on the team to really support them through that positive change, but change can still be hard, right? So
Yeah.
um, it really does take a team approach, and that's really the approach that we take. And I think that's the way we deliver the best care. It can be a lot to hold space for patients that are really struggling if you're the only one on the team. And so that's also my advice to anybody who's in private practice who or thinking about starting a private practice. Surround yourself with like mentors, surround yourself with other people that are doing what you want to be doing, because it can get lonely, it can be scary. You don't want to be treating a bunch of suicidal patients by yourself. That's really hard and stressful. So for me, having a team-based approach is really fun. I learn a lot from the other people on the team, and I'm parts of lots of teams. So like the patients are kind of like creating their teams, and I might help bring, who was missing from the team. I might help them bring on some more support.
Yeah.
So I think, and then team, starting up a private practice, there's a lot outside of just the clinical things that have to be done. And for a lot of us who spend our time training in medicine, a lot of times the business aspects are the harder parts, managing people, putting it all together. So getting more support like that with companies like yours, or there's lots of different resources out there.
Yeah, I love that. I think collaboration is a must. And I think everyone has the same end goal in the mind is to see the patient get better. And what better way to do that is look at the issue or their case holistically and saying, okay, I'm going to build the best team to get this one individual better. How can we do that? How can we all work together to make that happen for them? And so I love that you're so open to communicating. And I think that is the number one key point is that you are an expert of your field, but you might want another expert in a different field to also aid in the recovery. And so I think that is such an awesome pro tip for everyone involved as a patient. And then on the clinical side is build a great team for
Yeah,
yourself.
absolutely.
That's amazing. Dr. Giles, this has been phenomenal and amazing. I'm so happy we had you on today. And before we leave off, I would really love for you to share how folks can find you, how they can reach out if they're interested in chatting with you or one of your team members about, everything that you do and how you can help them.
Thank you. Yes. Well, thanks for having me. This was really fun. Um, so we have a couple of resources. So probably the easiest way to find us is just going to our website, which is breakthropsych.com. And the big thing to remember about how we spell our name is we shorten the name. So it's breakthrough THRU instead of the proper way of spelling it. So breakthropsych.com. We also share blog posts, articles. We like to share about our whole team on LinkedIn, on Facebook. We also have an Instagram handle which is at Breakthru Psych. So BREAKTHRUPSYCH. I know that's a mouthful. But yeah, those are probably the easiest ways. We would love for patients to reach out and call us if that's easier. 470-231-2235. We have an entire patient engagement team that really takes the time to speak with any patient who's really interested in our treatments for free. A lot of times they'll spend at least an hour on the phone with them, going through all the treatment options, helping them try to identify what makes the most sense for them. We run their insurance, so that patients can really kind of know like what it looks like financially for them to do treatment, because oftentimes that does play a role in decision making. So we do really try to support them as much as possible, educate them, and we're happy to do that anytime somebody feels like we might be a good fit.
That is amazing. Thank you so much, Dr. Giles, for all the information. Folks, reach out. Such a great resource to have. And again, appreciate your time and hope to have you on again very soon.
Thank you. It's such a fun time.
Same. See you soon.